So good afternoon. I am here with our Commissioner of Health, Dr. Michael Mendoza, and our Airport Director, Andy Moore. As you know, in light of the international 2019 novel coronavirus outbreak, the Trump administration issued new travel restrictions related to air passengers arriving from China. The goal is to prevent the virus's spread through the United States. While there are 11 confirmed cases of the novel coronavirus in the U.S., there are currently no confirmed cases of this virus in New York State or in Monroe County. My administration has been talking regularly with federal and state health officials from the Centers for Disease Control and the State Health Department and continues to work closely with them so we can implement the federal quarantine protocols and keep Monroe County residents safe. We are also coordinating with local health systems, universities, and schools. I want to emphasize that while I know there's been a lot of media attention on the coronavirus, the risk of contracting the illness in the United States is low, so perspective is key. I think Dr. Mendoza is going to agree with me that the coronavirus is a concern because it is new, but the influenza remains a far more serious threat to public health. So far this year, there have been more than 70,000 confirmed cases of flu in New York State, and the season is not showing any signs of letting up just yet. This past weekend, there were 2 additional flu-related deaths announced here in Monroe County, bringing this season's total to 4 people. So I'd ask you to please remember the best way to prevent the spread of both viruses is to wash your hands, cover your coughs and sneezes, and please stay home if you are sick. It is never also too late to get your flu shot. I also want the public to be aware that the New York State Department of Health has made a hotline available. The number is 888-364-3065 that residents can call. This is a public hotline number that residents can call if they have questions about travel that they have coming up or if they have clinical questions itself about the virus. Again, that hotline number is 888-364-3065. So with that, I'm going to turn the microphone over to Dr. Mendoza, our Commissioner of Health, and then he'll be followed by our Airport Director, Andy Moore. And these 2 gentlemen can provide information on our efforts here in Monroe County and will be able to answer any questions that you might have related to travel and the virus itself. Thank you.
Good afternoon. Thank you, County Executive Bello, for the introduction. It would not be complete to begin a talk about the winter viruses and this virus without talking first about influenza. As you heard earlier, as of January 25th, we've confirmed over 2,392 cases of influenza in Monroe County alone. And as you heard, we've had, unfortunately, 4 deaths and over 330 hospitalizations. Nationwide, 19 million cases of influenza, 180,000 hospitalizations, and 10,000 deaths. By contrast, nationwide for coronavirus, we have 11 cases and no deaths. I put that out there not to minimize the importance of coronavirus, nor the efforts that we're putting in to try to contain this, but as the county executive said, perspective is key. And public health, from our perspective in public health, influenza remains a far greater concern than coronavirus is at this time. But with that, I want to summarize what we know currently about coronavirus, talk a little bit about our response to date from the health department and across the county, and then talk a little bit about what we're doing going forward from the standpoint of isolation and quarantine, which I think a lot of people will have questions about. So first of all, just to set the record straight, what we're talking about is a novel virus. And by novel virus, we mean a virus that has not been seen anywhere across the globe. It's a new strain. And because it's a new virus, nobody has immunity. There is no vaccine against this virus, and there are no specific medical treatments to counteract this virus. That being said, we do know that this virus comes from the coronavirus family, and this is a family of viruses that is well known to us. Many of you in this room may recall that in 2002, we had the severe acute respiratory syndrome coronavirus, or SARS coronavirus. And 10 years later, we had Middle East respiratory syndrome, or MERS coronavirus. Both of these were global epidemics that were contained through good public health measures and prevention efforts in our local healthcare systems. I think it's also important to point out that coronaviruses live among us. They are implicated in any number of the viruses that cause the common cold, and in most cases, these illnesses are self-limited, causing mild symptoms like fever, cough, and sore throat. But there's still a lot that we don't yet know about the coronavirus, and one is we don't yet know exactly how lethal it is. Initial reports out of China are a little bit skewed, unfortunately, because they come from people who are hospitalized. They come from the earliest cases. And whenever you have an outbreak, the earliest cases tend to be those who are most at risk, and they tend to be the most sick. So as we go in the coming weeks and months, we'll see the fatality estimates continue to go down. But based on the current knowledge, we believe that the 2019 novel coronavirus is less severe than SARS, but more severe than the seasonal flu. We believe that it is a little bit more contagious than the seasonal flu, about as contagious as the common cold, and far less contagious than the chickenpox or the measles. And when you look at those two dimensions, the most important thing to consider is it in our community at this time? Because whether it's lethal or not, whether it's contagious or not, if there is no virus here, it really doesn't matter. And that is currently the case in Monroe County, where we currently have no cases, no suspected, no confirmed cases of coronavirus. And so at this time, the risk to the general Monroe County public is very low. With that, I want to talk a little bit about what we've done so far from the perspective of the health department. I want to call your attention to this plan. This is the Monroe County Isolation and Quarantine Plan. This is a plan that we've had in place for almost 7 years now. And it's a plan that we dust off from time to time. Most recently, we used it in the context of the measles outbreak that we had last year about this time. And it really is, with the exception of the fact that so much information has been coming out from the CDC so quickly, implementing this plan really hasn't gone any differently than it has in the past. So really the challenge right now is trying to incorporate all of the new information that's coming out from the CDC and from the state and plugging that into our plan. But once we have the information in place, this is generally what we do in the health department. I want to recognize that we've been in almost daily, if not 2 or 3 times a day, communication with both the CDC and the State Department of Health. We've been coordinating across the county, including with Director Moore and others across the county. I've been in close contact with the University of Rochester Medical Center and Rochester Regional Hospital, trying to coordinate our efforts both around communication to medical professionals and to their patients, as well as our local institutions of higher learning and K through 12. I want to take this opportunity to thank my staff who have worked long hours over the last weekend and week to help to contain this. But with that, I want to look ahead to what we're going to be doing in the coming days and weeks. So you may have heard of the terms isolation and quarantine. So to be fair, to be clear, isolation refers to separating people who are sick or who are suspected to be sick with a contagious illness from the rest of the public so that we can contain its spread. We won't get too far into the definition of what a case is, but suffice it to say, to be a case who's suspected or confirmed in the United States at this time, you have to have a travel-related risk and you have to have symptoms. And we currently do not have any of those meeting those criteria here in Monroe County. Quarantine, on the other hand, refers to identifying people who have that travel-related risk in this case, trying to contain them from the public and observe them appropriately to make sure that they don't develop the symptoms. And if they do, then we know to take appropriate precautions. And this is very analogous to what we did this time last year with the measles. So currently, we have one individual in this county who is under voluntary quarantine. This is an individual who came from mainland China in the appropriate period within the last 14 days. And we've been in touch with this individual. This individual is under voluntary quarantine in his or her home. We're contacting that person every day, confirming that the person has no symptoms. And we'll be doing that for the duration of the 14-day period. And the 14 days comes from a very conservative estimate that the incubation period for this virus is far less than 14 days. So while some of this may seem unsettling or alarming to some, I want to encourage the public to take a step back, while I reiterate the key points from what I've just said and try to put it all into some perspective. Influenza is far more common and, as a public health threat, far more significant locally than coronavirus. We have thousands of people who are actually sick with the flu, and no one currently who is sick with this coronavirus. So the best thing that we can do as a public here in Monroe County is to protect ourselves against the flu. As you heard, the most important precaution is to get your flu shot. It is not too late. It is widely available in our doctor's offices and pharmacies, and we have a flu shot available as well in the Monroe County Health Department if that's most convenient to you. Wash your hands thoroughly for 20 seconds with warm soapy water. Hand sanitizer is an appropriate alternative. Cough into your sleeve, use a tissue when possible, and most importantly, stay home if you are sick. Although the current risk from the coronavirus is very low, we are taking all reasonable precautions to contain this virus. We're working very closely with the State Department of Health and the CDC, and my office stands ready 24/7, as we usually are, to follow up on the latest developments and to field any calls from our local healthcare providers. Today's precautions are really meant to be out of an abundance of caution, to do everything we can to keep the Monroe County public safe. So with that, I'm going to hand it over to Director Moore, who can field questions from the airport perspective.
Thank you. First of all, I'd like to thank County Executive Bello and Dr. Mendoza for their leadership in this public health effort. I'm going to start from the federal level and kind of work down to the local level here as I go through some comments. First of all, the United States Department of State has issued a Level 4 travel advisory. A Level 4 travel advisory is the highest level of concern and basically is do not travel to that destination. That Level 4 is issued for the country of China. Some similar examples to a Level 4 advisory would be that of Libya or Somalia or Sudan. The Department of Homeland Security has also designated currently 11 airports for screening of all passengers from China. Customs and Border Protection and the Center for Disease Control, CDC, will be conducting the screening. The 11 airports are major domestic-based U.S. hub airports here in the United States. Airports similar to JFK, Newark, Chicago O'Hare. You would have another airport such as LAX in San Francisco. So these 11 airports screen both direct flights from China and non-direct flights from China. A direct flight being, let's say, from Beijing into JFK, and a non-direct flight would be, for example, from Beijing to London and then London to Boston. Now, Boston is not one of those 11 identified airports. So Customs and Border Protection with TSA and the airlines would make every effort to communicate with that passenger and redirect that passenger back through one of the 11 airports, such as JFK, to enter into the United States for screening. On Sunday, February 2nd, the U.S. Department of Health and Human Services issued travel restriction protocols. U.S. citizens traveling to China in the last 14 days outside of the city of Wuhan or Hebei province will be screened at one of the 11 airports. If they have no symptoms, they will go on to their destination and do self-quarantine. If someone traveled through the city of Wuhan or Hebei province in the last 14 days, they will have a mandatory 14-day quarantine. Non-U.S. citizens, and there are some examples such as flight crews or having a relative of or being a relative of a U.S. citizen, will be denied entry into the United States. For U.S. airline carriers, as of today, there are no flights to the city of Wuhan into the United States. Delta Airlines, American Airlines, and United Airlines are the major U.S. carriers going to and from China. Delta Airlines suspended flights to China starting Sunday, February 2nd. American Airlines suspended flights from China starting January 31st. That was last Friday. And United Airlines will be suspending all flights to China starting Wednesday, February 2nd. And that may change over time on the length of those suspended flights. Internationally, over 30 carriers have reduced or canceled flights in and out of China. Carriers such as Air France, Air Canada, and British Airways, for example. Airlines are rebooking and have waived fees. Here locally, for a minute, just want to touch base on a couple things. There are no nonstop flights to and from China or Wuhan out of the Rochester airport. There are no changes in TSA protocols. I've had multiple conversations with the Federal Security Director from TSA, and there are no changes here in Rochester. There are no changes in Customs Border Protection protocols. I've also had conversations with the Port Director here in Rochester, New York, of Customs Border Protection. WROC flights are departing and arriving as scheduled under normal circumstances. I want to be very clear with the public that the airport is open and operational and no changes to protocols. Obviously, we will follow all direction from the county executive, from the Department of Health, Dr. Mendoza, the New York State Department of Health, and the CDC. And I also stay in touch with the National Airport Organization, AAAE. We currently and continue to strongly encourage any passengers that have international travel to be very diligent in checking with their airlines about their travel, as itineraries may change from time to time, and just be diligent in communication with your airline if there's any changes in your flight schedule, whatever that may be. So with that, thank you very much.
All right. Thank you, Dr. Mendoza and Mr. Moore. And if there's any questions that we can field related to the virus or the airport restrictions, take those now.
Dr. Mendoza, the person who's under quarantine, when did you find out about that? How did you find out? And are there any concerns with anyone who would have been in contact with him while he was traveling back here?
So we learned on Friday evening that this was coming. We had a call convened by Dr. Zucker, who's the State Commissioner of Health. He called us on Friday evening to convene a call on Saturday at 11. We went through, a review of all of the procedure, and this was slated to begin on Sunday at 5 o'clock. We made the decision in conjunction with the health department at the state level that we would go back to include individuals who traveled on Saturday. And it turned out we did that because this individual reached out to us on Saturday before this was actually going to go into effect. And so this person has been extremely cooperative and is staying at home. It's for 14 days after their exit from China. And so this person has, 12 more days.
Because it was Saturday that, I'm sorry, there's a lot of dates given.
Yes.
Can you go through that one more time for me?
So we became aware of this individual on Saturday. This person reached out to us.
So from a medical perspective, typically what do you see, how long do we expect people not being able to go to and come from Wuhan, China?
Well, it really depends on how this pans out across the globe. The epicenter, as you know, is in China, and that is something that obviously is being followed very closely. From our standpoint here, we're taking our guidance from the CDC and the State Department of Health. The operative duration is 14 days. So from any relevant exposure, the 14 days following that is the period that we're going to be of most concern. And beyond 14 days, you're essentially clear. And so those are the realities that we know as of right now. But obviously this is a very dynamic situation. So as things change, we'll update the public.
So just to clarify again on this one individual, you learned Saturday that person, I think you mentioned, has 4 more days in the quarantine period, which means that they came back from China, not Saturday, but...
No, they came on Saturday. They returned to home here in Monroe County on Saturday. Yeah, and then we count from the time this person left China plus 14 days.
Right. So the person that left China, they went sometime previous, a week earlier?
No, probably a day or two, probably, yeah. So that quarantine period ends, I think, on the 13th, I want to say.
So the quarantine period began Friday?
The quarantine begins, the observation period is for the 14 days following exit from China.
And what's day 1 of that 14?
I think it was Friday, yeah.
Okay. Can you walk us through, like, what are the logistics of being quarantined? How do you get food? How do you see family?
So there are various flavors of quarantine, and I don't know how much you want to get into that right now, but there are the mandatory quarantine. So in this case, a mandatory quarantine, well, let's take it one step beyond that. If somebody is symptomatic, or if somebody here in Monroe County becomes symptomatic, we would be in touch with the State Department of Health, and the plan at that point would be to put that person under a mandatory quarantine. In our plan, we have a process that involves a whole lot of legal paperwork to essentially confine that person to his or her home. Under that plan, we would be responsible as a county for ensuring that that individual has their medical care, their food, and their wraparound services available to them. And so we have done this in the past for individuals with different communicable illnesses, and so this is something that we're very comfortable with. But that would be what we would do in the case of a mandatory quarantine. For a voluntary quarantine, it really depends on an assessment of that individual's risk. And so we would do an assessment of that home or the living situation where that person is, and then we would make an assessment in conjunction with the state. Now, we have typical criteria for other illnesses that are not novel illnesses like this one. So in this case, it's a new illness, so we're kind of learning about this as we go, and so we're working very closely with the state to develop what would be the appropriate quarantine under that scenario.
So this person was voluntarily quarantined then? This was voluntary, this was not, like they weren't showing any symptoms?
Correct. Quarantine is asymptomatic.
Okay, great, thank you.
The fact that this is a voluntary quarantine, this person could end it at any time?
No. So we're in touch with this person, and we have technological ways of knowing where this person is. I've evaluated the situation. This is about the best scenario that you could possibly imagine for a quarantine.
So what is it though? What does he agree to do, he or she agree?
This person's agreed to stay in the home and be in touch with us. We're having this individual check their temperature according to our plan. We're evaluating the situation both for other symptoms and for fever. And assuming that there are none of those things, at the end of the 14-day period, we'll be all set.
Why do you describe this as like the best scenario for a voluntary?
This is a very cooperative individual.
There was some individuals over at the University of Rochester connected with them that were being monitored by the university system. What is your understanding of that? What role have you had in that? And where are we at with all of that?
So that was never considered a quarantine because there was actually no plan for a quarantine at that time. So what the university was doing really was out of an abundance of caution on their part. So they were monitoring these individuals. They were allowed to go about their usual activities as a student or staff. But we also know that all of these individuals are now well, they are healthy, and they are outside of their 14-day period, so they're no longer people that we're monitoring.
The state health department says there are 3 people outside the state of New York who are suspected or potential cases. Is this one of them, or does that not count because there are no potential symptoms?
I'm not sure what you're referring to as a 3.
So my understanding is there are 3 people in New York City and 3 people outside of New York City who are suspected cases.
So we have none here.
This person is not being
Not here.
evaluated
So
because
suspected,
of their symptoms.
correct. This is not one of those people. A suspected person has symptoms.
Plus travel history.
Well, in this case, plus travel history. Right.
Okay. Great. Thank you all very much for being here today and covering this. Thank you.
Thank you.
All right. Yep.